Herniated disc, what is it? Can it be fixed, and does it require surgery? First, we have to understand what a disc is. So a disc is the cushion between each bone in your spine or your vertebrae. So when we look at the spine model here, each vertebrae, the bony part, is sandwiched with a disc. So the disc is in the middle and it provides cushion and is a shock absorber. It also allows flexibility of the spine. So as we age, that cushion gets thinner, and this is often called degeneration. So degeneration is a normal part of aging, and it's really when that disc loses some of the fluid, some of the elasticity in the disc itself. And that's just a normal part of aging. It can also be classified as degenerative disc disease, but it is not a bad thing. It really is normal aging. With repeated stress to our spine, including bending forward, lifting, sitting with poor posture, the disc starts to thin even more, and those repetitive stresses can sometimes cause a tear in the disc tissue itself, which then causes a leak of that fluid in the disc space. That leak is considered a bulge. So a disc bulge is really this red part here. So when the disc itself has a tear in the outer portion, the fluid starts to leak out and it'll present like a disc bulge. This is a disc bulge. It can also be called a herniation, and it is simply when the disc itself has a tear. Normal aging can cause this, or it can happen from a serious injury like lifting or something heavy. Poor posture repeated over time, standing or sitting, can also cause a disc tear, which then can lead to your bulge or herniation. So if you have a disc bulge, this can cause pain, numbness, tingling, weakness, and sometimes other dysfunction like difficulty standing, difficulty getting out of a position, being forward stooped, or leaning in a certain direction. The amount of pain you may have with a disc bulge does not indicate how severe the disc bulge is. Sometimes you can have a disc bulge with no pain at all, no symptoms. Typical symptoms of a disc bulge include pain in the neck or the low back, numbness and tingling in the arms or legs, difficulty getting up from a sitting position, stooping forward, and difficulty standing upright. Sometimes you'll have a leaned presentation to one side or the other and difficulty getting into an upright position or straight. These are all symptoms of a disc bulge, and they all can be treated with physical therapy. An X-ray or MRI is rarely indicated for a disc bulge. In rare cases, a physical therapist will recommend that you have a MRI completed, but that's typically not the case because we can usually treat a disc bulge or herniation through movement modification, exercises, stretching, strengthening, and pain reduction techniques. So if you are experiencing any of the symptoms I described, or you think you may have a disc bulge or herniation, I encourage you to seek physical therapy and subscribe to my channel to learn more ways to help prevent and decrease symptoms associated with a disc bulge. You can also follow me on Instagram at more.than.physical.therapy. And don't forget to follow, like, comment, and share my content so that I can reach other people and these common pathologies of the back, spine, and general body can be shared.